Hello there. I am Dr. Velma Tarmina. I am a wife, a mother, a daughter, and an OBGYN. Over the course of my lifetime, I've had the privilege of working with women from all walks of life. And especially as an OBGYN, one of the things I consistently see is that women do not always make time to care for themselves. So in this video, we're going to discuss self-care. What preventative services are recommended for someone your age? We're going to use the tool, the Well-Woman Chart, which outlines what preventative health services are recommended for an individual based on their age. So I'm going to share my screen so that we can look at the website together so that you'll understand where to go to get the information that you need. So here's their homepage. You can find this by going to womenspreventativehealth.org, and you'll see on this main webpage that it gives you an overview about what the work is. And if you toggle on the Well-Woman Chart, you can come down to here, which will download a copy of the Well-Woman Chart, or you can use their interactive tool. For purposes of this video, I'm going to scroll down to this and download a copy of that. It is in English and in Spanish. So this is a nice, colorful handout that literally on one page is going to give you the recommended preventative health services that are recommended based on your age. They break down the categories into general health, infectious diseases, cancer, pregnancy, and postpartum. So based on your respective age, you can very easily look at one place and determine what needs to be done. So remember that these are health screenings, not maintenance recommendations. So for instance, I am in this category 50 to 64. I wouldn't be necessarily having lipid screening because they've already determined that I have a high cholesterol level. And because of that previous screening, we identified a problem. We put me on medication to control my blood levels, and I'm now in maintenance phase. But if you have not had a previous problem with that, then your clinician should be working with you to identify an interval during which they will repeat the blood test to make sure that you don't need any additional testing or medication. So if you need information about why they're making those recommendations, you can come down and download the clinical summary tables. And again, that's in English and Spanish. And when you do that, you will see that they break down every single recommendation and give you the rationale behind why they're making that specific recommendation. So again, just looking at alcohol screening and counseling, they will tell you the rationale for it, what their recommendation is, and then they'll provide your clinician with the screening tools that they can use to perform this in their office setting. So as you can see, that's a very handy tool. One website gives you the information that has been compiled by experts across the country. And by informing yourself about what's needed for your individual age group, you can determine what needs to be done. So the next time you go into your clinician's office, take that tool with you, take a picture of it on your smartphone. And if they don't address that while you're there, then I would respectfully question them about what their plan is for that. This is your health. This is your personal health journey, and you need to take charge of it so that you can ensure that you're here to enjoy doing the things that you want to do. So until our next video, if you have any questions about the content that we've covered, just drop a comment in the section below. I will put a link to this website in the description. And if you like what you heard, give us a thumbs up. If you would like to subscribe to our channel, you'll be notified about any future videos that come along your way. And until then, take charge of your health, do your research, and schedule that appointment.